It is the 10th Ebola outbreak in the Democratic Republic of Congo, and it's the worst to date. First declared last August, the hemorrhagic fever has killed more than 500 people so far and infected over 300 others. Symptoms of Ebola include severe headache, muscle and abdominal pain, diarrhea, vomiting. The Ebola virus, which also causes severe bleeding and organ failure, kills at least 50% of patients. Dr. Matshidiso Moeti is the World Health Organization's Regional Director for Africa.
What's worked is public health measures such as training health workers on infection prevention and control in the health centers, closer engagement with communities, particularly women's and religious groups, and other public health measures such as case investigation, contact tracing, and we now have the use of innovative tools like the investigational vaccine and new drugs.
The Ebola virus can be transmitted to humans from wild animals. The current outbreak in eastern DRC is the second largest in history after an Ebola epidemic in West Africa killed more than 11,000 people. The West African epidemic marked a turning point in Ebola response. Researchers conducted trials for a new vaccine known as RVSV-ZIBOV made by Merck, which proved to be safe and effective against the Zaire strain of Ebola virus. The vaccine is now being used in the DRC.
The point of the research is the only time you can really do it is in the midst of an outbreak, because that's the time when you have human cases. So if we don't use these opportunities to learn what are the most effective vaccines and drugs, then we'll never actually know more.
Until recently, doctors have managed the symptoms of Ebola with fluids and electrolytes, oxygen, blood pressure medication, blood transfusions, and treatment for other infections. However, in another breakthrough in the Ebola response in the DRC, 4 new therapeutic drugs are being utilized for the first time. The World Health Organization says more than 250 people have been cured and 80,000 protected through vaccination during this latest Ebola in the DRC. Well, Ebola diagnosis has also improved. Thanks to a small machine called the GenExpert, simpler tests are now being performed rapidly and close to transmission zones. The new test was developed towards the end of the West African epidemic.